Well, nearly a year into the pandemic, Dr. Brooks Fallis was cut from his job as interim head of critical care at the William Osler Health System in Brampton. His story recently resurfaced on W5 when he decided to go public as he searches for answers as to why he was let go. Fallis has openly criticized the Ontario government's COVID response, sometimes tweeting out his frustrations directly at the Premier. When hospital officials addressed their concerns with Dr. Fallis, he recorded some of those conversations.
There were the number of interviews that we weren't aware of. Then there were some comments directed at government and at the Premier.
Some of your remarks have been misconstrued as being harmful to the government, so our funding can be put at risk.
These guys can be nasty in a way that you don't even know they're being nasty.
Leadership team backpedaled, insisting political pressure was never a factor in Fallis' dismissal. Fallis disagrees, but says he doesn't believe Premier Ford got him fired or even made the request. William Osler turned down W5's request for an interview, but in a statement said the allegations of political influence were, quote, categorically untrue. Back in early 2021, Premier Doug Ford also weighed in.
I would never direct the CEO to promote or fire someone. It just never happened.
All right, joining us live this morning is Dr. Brooks Fallis. Good morning, Dr. Fallis. Thanks for joining us here. So this story aired back on March 26. What has the reaction been since this piece ran on W5?
From my perspective, it's been very positive from colleagues, from physicians and other healthcare workers across the country, as well as sort of general public, social media, things like that. I think if you watch the W5 piece and look at all the evidence, it's very clear that there was pressure applied on the hospital for me to stop speaking publicly and stop being so critical of the extremely political response to COVID-19, and that the hospital undertook that response to try to limit what I was saying publicly.
And it's interesting too, Dr. Fallis, because the Premier's office denies knowing who you are, yet those conversations that you recorded with Osler Hospital management all infer really that the province was unhappy with your commentary, and then just days before you were fired as head of critical care, they had that transcript of an interview that you gave to Global News. Does this all add up to you?
To me, it all adds up very clearly from the evidence that we have, that particularly around a 4-day time period when I lost the position, that I did an interview on Global News where I was talking in detail about the fact that the limitation in expanding ICU care capacity is based on staffing, not based on space. Space was never a problem. Monitors were never a problem. Ventilators were never the problem. The problem was always going to be the number of skilled staff to provide that care. That interview was on a Friday, and on the Monday, the government had announced the early opening of the Cordalucci Vaughan Hospital, implying that we suddenly had all this extra hospital capacity. But of course, the staff to take care of those patients were just reorganized from other hospitals. So it wasn't truly new expanded capacity. It was just rearranged capacity. I did that interview on a Friday. The Osler senior management team told me they were pulled into a meeting as a result of that interview. And then the next morning, they were approaching someone to take over my position. And on Monday, I received a letter of termination. So it seems that it all happened in a very sort of short period of time. And then when I submitted freedom of information requests, that interview with Global News was transcribed in its entirety in an email that was circulated to the Premier's office as well as the Cabinet office.
Yeah, and it's curious, because the piece also shows senior management of the hospital changed its story in the terms of why you were terminated. Have you been able, in your FOIs or otherwise, to get any more clarity as to why you were let go?
No, I don't think there is or will be more clarity. What happened, I think, was that I was terminated. They gave me the honest answer, which was consistent with, internal emails in their FOI, in the FOI of the hospital. It was consistent with a meeting in November. It was consistent with a meeting in January. And then when it went public, they sort of backtracked on what they had said had happened and changed the story, and said this clearly this is not what happened. But it's just it's not really credible that there was no reason to terminate me when on the other side of the coin, they've been telling me and said very publicly that they were happy with what I contributed as a leader in the pandemic within the hospital. And the only thing that made them unhappy was the criticism of the government publicly.
And so it's interesting when it comes to criticism from doctors. I mean, you're not the only one who was sort of calling out, provincial or even federal policy at the time. Your story really kind of highlights an issue in the system when it comes to, doctors advocating for patients in the healthcare system or offering health advice based on expertise and experience. But then when it kind of differs from the guidance given by the province, there doesn't seem to be any recourse. So what would you like to see changed when it comes to that model?
Well, I think that the crux of the problem here is a really underfunded healthcare system. So there's a very small pie for, new projects and capital development, new hospitals, and each hospital system is desperate to get their hands on some. And the best way to get your hands on that money is to, please the government, have a good relationship with the government, and then perhaps your project will get funded. So if the system was well funded and there were no concerns over beds and projects, then the hospital wouldn't mind that I'm out there being critical or doctors are advocating, but it's that risk of upsetting the government or the ministry, and that leads to less funding. That's just built into an underfunded healthcare system. So on some level, I don't really blame the hospital for being worried about what I was saying, because they legitimately were concerned that they would lose important funding that the community really needs. But to me, that speaks to a very problematic system when we're trying to create an equal opportunity universal healthcare system.
Yeah, a difficult dynamic indeed, Dr. Fallis. While I have you here, you are an ICU doctor. We're in the 6th wave right now. I wonder what you're seeing and experiencing currently and what your concerns are about where things appear to be going in the province, if at all.
Well, my concern about how we respond to COVID in general remains the same as it always has from the first, opinion piece that I wrote that got me into a difficult relationship with the hospital. And that's that we continue to have a politicized view of how the pandemic is being managed. I mean, right now we're clearly taking off in a very steep 6th wave. The wastewater data, which is probably the best we have for what's happening, is taking off rapidly and rising every day. So it's going to get bigger. Nobody knows how big. And it probably will start to hit the hospitals in the coming days and weeks. There are very simple measures that we could be taking, but I think that the government will be reluctant to backtrack on the things, on the sort of control measures that they had in place. I think they'll be reluctant to open up testing, extend the isolation period to match the period of infectivity that people actually have, and reinstate a mask mandate. But all those things would help. Then unfortunately, we are really flying blind right now. We don't know what's going to come. We're seeing patients trickle into the hospital now, although thankfully so far ICUs have not been overly impacted, although I do expect that to change in the next 2 weeks.
Okay, well, it's certainly something we continue to follow very closely, and we appreciate you coming on, Dr. Fallis, to talk more about the reaction to the W5 piece and kind of where things are right now. Appreciate the time as always.
Thanks for having me.
Okay.
Take care.
And we also want to mention Dr. Fallis did make, as he alluded to, a Freedom of Information request with the government and found an internal Premier's Office and Cabinet Media Awareness email with that fully transcribed Global News interview with him on January 15th, just 3 days before his termination. This is the response we received from the Premier's office yesterday. Quote, "Our office receives thousands of transcripts and clips of interviews with outlets across the entire province. Again, as I've previously said, we had never heard of this individual, and the allegations he made and continues to make are categorically false. William Osler has already stated publicly many times that at no time has the Premier's office ever given any direction or advice related to human resourcing matters at the hospital."